If you ever get an annoying snapping, popping, or clicking sensation in your hip that you notice especially when lifting your leg, walking, or going up and down stairs, you've come to the right place, because in this video, I'm gonna show you a simple self-assessment to help you figure out what's causing your problem and a 3-step home exercise routine to help you eliminate snapping hip once and for all. Now, there are actually 3 different types of snapping hip syndrome, and the presentation and the underlying cause of the problem varies depending on which type you have. The most common type of snapping hip syndrome occurs when there's too much tension on the iliotibial band that runs along the outside edge of your thigh here. And when that band gets too tight and you go to move your thigh, it begins rubbing just like this across that bony bump called the greater trochanter. Thankfully, there's a simple test that you can do to figure out if your hip abductors are pulling too hard on your IT band. To perform that test, just go flat down on your back. From there, lift up one leg with a bent knee, grab a hold of that knee with both hands, and slowly begin pulling it up towards the shoulder on the same side. And what you want to pay attention to as you pull is what happens to the foot on the down leg. So here, no matter how hard I pull, that foot stays in place, and that's normal. But when I pull on this opposite side, notice what happens to my foot. It begins drifting in this direction into abduction, away from the midline, and that is a strong indication of a tight TFL on my left side. The following series of exercises are things that I've found to be super helpful for people who have a positive indicator on the test that we just went over on the same side as their snapping hip. Step 1 is to release the pesky little muscle here on the outer edge of your hip called the TFL, whose main function is to keep your IT band tense at all times. For that, we're going to be doing a side-lying abductor stretch. To set up for this stretch, go flat down on your stomach on a comfortable surface. Hands should be directly underneath your shoulders as if you were setting up for a push-up, and then you're going to push up just slightly and roll yourself over onto the hip that tested positive earlier. You're then going to draw your opposite leg up with a bent knee, place the foot flat on the floor, and then push off of your foot and your hands to get yourself up over the hip that tested positive earlier. The opposite arm is going to rest right on top of the bent knee, and then you're just going to allow your body weight to settle in directly over the upper outer edge of that hip, where you should start to feel a pretty intense stretch. Now, the straighter that you can keep the down leg when performing this stretch, the better stretch you're going to get. You want to hold this position for 30 to 60 seconds continuously. Just allow your body weight to relax into that stretch. And then when you finish up, gently slide that leg back, ease yourself down, and relax. If you find that full side lying position to be too challenging for you, here's a less demanding alternative that can help ease you into the benefits of this type of stretching. Go flat down on your stomach on that same comfortable surface. Hands are still starting in the push-up position, and you're still going to roll yourself towards the hip that tested positive earlier. From there, draw the opposite leg up, bend the knee, place the foot flat on the floor, and then from there, all you need to do is push up with both arms, creating a little bit of arch in your lower back, and allow the front of that down hip to ease down towards the floor. Breathe deep through the nose. On each exhalation, try and allow that down hip to fall a little further towards the floor. Hold for 30 to 60 seconds continuously. When you finish, straighten the bent knee, slowly lower yourself down towards the floor, and you're done. Step 2 is to begin strengthening the muscles that directly oppose the TFL to help restore balance to the hip joint. One of my favorite exercises for doing that is seated band-resisted hip external rotations. The only things that you're going to need for this are a chair to sit on and either an exercise loop like these or an exercise band. Once you've got that, scoot yourself to the edge of your chair, slide your band around your legs. You want it placed at the level of your knees like this. Knees and hips should be bent to about 90 degrees, and you should have about 4 inches of space down in between your feet. Then you're going to grab hold of the sides of your chair for stability, lightly brace your core, and you're going to try and touch the outside edges of your knees down to the floor, just like this. Notice that at the top of the range of motion, when my knees are as wide apart as they can get, the inner edges of my feet are completely off the floor. This demonstrates that my hips are externally rotated and that I'm targeting the right muscles. Hold for 2 seconds at the top and then slowly return to the start and repeat. As good as this exercise is with a resistance loop, it's even better with a band in my opinion, because when you loop the band around your knees like this and then anchor your hands in place, you've got a much greater range of motion available to you during the exercise, and there's a ton of different options and different resistance levels available when it comes to bands. So you can certainly find something to directly match your current fitness level and allow you to get the 15 to 20 reps that we're after with this exercise. Step 3 is what I call a finishing move. You can think of this exercise as the cherry on top. It's going to help you to integrate the changes that you've made and increase stability at the hips and pelvic ring. And for that, we're going to be doing seated isometric hip adduction. The only things that you're going to need for this are a chair and a small ball. Soccer ball, volleyball, myofascial release ball all work great, or in a pinch, you can use a foam roller. Once you've got that, you're going to scoot yourself up to the edge of your seat. You want your knees and your hips bent to about 90 degrees. You'll then take your ball or your foam roller and place it directly between your knees, just like that. Your feet should be pretty close together, about 2 to 4 inches apart. And then once you're there, you're gonna brace yourself with your hands along the sides of your chair, sit up nice and tall, and you're gonna slowly begin ramping up force as you squeeze your knees together. Now you wanna squeeze only up to the point that you're comfortable going, but you should max out somewhere around 60 to 70% of your total force output. And as you're ramping up that force, you're gonna feel tension in your inner thighs and maybe the center of your groin. You're gonna hold that squeeze for 10 to 15 seconds continuously, and then slowly allow that force to ramp back down to 0, relax, take the ball out, and you're done. So there you have it, a simple routine that can help you to get rid of your snapping hip from the comfort of your own home. And best of all, this entire process shouldn't take more than 5 minutes a day. If you're looking for some inexpensive but high quality exercise bands, I'll put links for the ones that I use and recommend in the description down below. And if you want more information on improving hip mobility, I've got a video that talks all about it, and you can see that by clicking the link here. Beyond that, I just want to thank you so much for watching. Make sure to hit the thumbs up button and the subscribe button before you head out of here, and I'll see you next time.